Well, it's a privilege to be here and really appreciate Congressman John Sarbanes coming out and visiting us here at Oak Crest. And since 2007, been our congressional representative from the 3rd District in Maryland. And Congressman Sarbanes in that 3rd District also is a representative of our sister community, Riderwood, down in Silver Spring, because it spans Anne Arundel County, Baltimore City, Baltimore County, Howard County, and Montgomery County. So, yeah, a lot to do, a lot to keep you busy. But many things that Congressman Sarbanes is involved in, but one, I'm pleased to say, is the environment. I know that's a passion of yours. I've read about that with the Chesapeake Bay. And you may be aware that we have our Baywise certification here at Oak Crest. And we are also in 2010, and residents and staff may remember Baltimore Business Journal. We won for a large business a Business of the Year for our environmental green participation in green activities. And we're very much aware of that. So, and there's a whole lot of things other than the environment, but I know that that's right at the top of your list, so we're pleased to have that affinity with you. So thanks for coming out, and we look forward to hearing what you have to say. Congressman Sarbanes.
Well, thank you very much for that introduction. It's a real pleasure to be here, and I have been in Congress since 2007, but only newly have I come to represent Oak Crest Retirement, because they redid the boundaries of the district, the 3rd District. Before, I had all of those jurisdictions that were mentioned in some shape or fashion, except I didn't yet have Montgomery County in the district. They've added Montgomery County, and including the Riderwood Erickson community. I guess to balance it out, they figured they had to add a retirement community for Erickson on this end of the geographic spectrum. So I now have Oak Crest in my district. I'm very familiar with Oak Crest, Riderwood, the Erickson communities, and frankly, senior living communities and continuing care retirement communities generally, because before I got to Congress, I spent almost 20 years working in that field. I was an attorney at Venable, which is a law firm downtown, and we represented a lot of these organizations, including Erickson, as well as many others. And so I really got to understand the issues that face our seniors, looking at it through sort of the provider lens. And I was privileged when I got to Congress that in my 2nd term there, I got an appointment to the Energy and Commerce Committee and the Health Subcommittee. So I've been able to be very involved in issues of health care in Washington, and it's something that I can claim some background and expertise in. I wanted to do a little bit more, though, just to introduce myself, since for some of you this may be the first time you're hearing from me or learning about me. I was born in Baltimore, grew up in Baltimore, went away to college and law school, and came back to Baltimore. My wife said to me, who met me in Boston, "I know you're going back to Baltimore, I can tell." And she was right. And came back, practiced law, as I said, for about 20 years in the healthcare field. Spent 7 years in a very unusual part-time arrangement where I was working part-time at the law firm and part-time for the state superintendent of schools, Nancy Grasmick, working on issues affecting the Baltimore City education situation. And that was a very interesting time for me. I got to really understand education in addition to my healthcare background. Also very involved in the nonprofit arena, serving on the board of many nonprofits in the Baltimore area. So I sort of had a foot in the public sector, the private sector, and the nonprofit sector. And when this seat opened up in 2006, because Ben Cardin, who was then representing the 3rd District, decided to run for Senate because that seat was vacated by somebody named Paul Sarbanes. I thought, well, if there's ever a time when I should look at this question of whether to get into public service as an elected official, this would be the time. And I won't tell you that it was a snap decision, because I'd been in a private space for quite a long period of time, and to make that leap into a public space is not something that you should do lightly. I have a family, and they were used to being the private space. I'm married with 3 children. 2 of them, well, one's graduating from college on my birthday, May 22nd. She's up in New York City. And the other is a jazz trumpet and jazz vocal performance major at McGill University in Montreal. He sings a lot of Tony Bennett and Frank Sinatra, and he plays a pretty mean trumpet, so I might see if we can get him in here one day, and you can make your own judgments about it. And then I have a 9th grader who's at Towson High School. All of my kids went through the Baltimore County public school system. 2 have graduated from Towson, and 1 will be graduating from Towson. So I clearly have a stake in making sure that that system is as strong as it can be. I'm one of the few members of Congress who has the real benefit, the advantage, the blessing, when you think about it, of being able to come home every day. Most of my colleagues who are flying in from Michigan or Texas or California, what have you, they come into Washington, they're stuck there for 4 or 5 days in what is a very, I was going to say high octane atmosphere, but it may be actually low octane when you think about some of the activity that's going on there. But they tend to feel cut off from their constituents during that time because they're well away from them. Many of them don't see their family during the week. I have the ability to go in, do my work, fight the good fight, get in my Ford Focus at the end of the day, and drive on back to Baltimore. I live in the Towson area. And so not only do I get home to my family, but I also get back and talk to constituents. This visit is part of an effort during May, which is Older Americans Month. We celebrate every year to get out and visit with our seniors. I've just come this morning from Pikesville Senior Center, Overly Fullerton Senior Center, and Bicota Senior Center. And must say that the energy and really the verve of our seniors was on display there as it is here. And it's an incredible resource we have as a society. And I will use an analogy I've been using all day, but I like it very much. We get a lot of testimony in Congress these days from experts about this huge demographic wave that is coming at the country, which is the baby boomer generation. The numbers are actually quite staggering. And the question that policymakers are asking is, are we ready as a country to handle that demographic wave? And when I think about that, I recall my time as a youngster when I would go to Salisbury, Maryland to visit my grandmother who lived on the Eastern Shore. That's where my father grew up, working in a restaurant, the Mayflower Grill. And we used to go down to Ocean City and go swimming in the ocean. And there were 3 things you could do when a wave was coming at you. One was you could duck under the wave, which didn't accomplish much. 2 is you could sort of turn and brace yourself for it, in which case usually it would just hit you and knock you over. The 3rd is if you turn and kind of positioned yourself just right and started to swim forward, that wave would lift you up and propel you forward. And that's how I view this demographic wave of seniors that's coming at us. If the country is smart enough to position itself right, then the energy, the talent, the experience, the enthusiasm really of our seniors has the potential to pick us up as a nation and really propel us forward. And it is resources and organizations like Erickson and the Senior Center infrastructure network that we have in Baltimore County and the other jurisdictions that I represent, which I think are going to make that really happen. So I'm really looking forward to this wave because I think it offers tremendous potential and benefits for the country. There are many issues we can talk about. I'm going to throw it open to questions shortly. Among them, the budget situation Washington, which I'm not proud of. There's too much quarreling and gridlock and dysfunction that goes on there. The tough issues of gun safety legislation, immigration reform, implementation of health care reform, and then the things that hit us that we didn't even think about the day before. You wake up, you read the paper, you hear about a terrorist attack in Boston that shuts down the city for 36 hours. I was on my way to my law school reunion in Boston, and they canceled it. It was scheduled for Saturday night. They made a decision Friday at noontime to cancel that because of what was going on in Boston. So we just never know what's going to be the next thing that comes at us as a nation or as a community. The important thing is that we hang together in the face of whatever the adversity might be. And that's sort of how I see my role in Congress and as an elected representative, to kind of listen as carefully as I can to my constituents, to keep my integrity, to work as hard as I can to ensure that there's a good quality of life. And I can never say that I'll agree with every one of my constituents 100% of the time. In fact, if I was claiming that, I would have to be talking out of both sides of my mouth. But I can pledge, because it's within my control, to work hard and to listen and to keep my integrity. And I think most Americans feel that if the representatives they send to Washington or Annapolis or where have you are adhering to those three basic principles, then most of the time, not always, but most of the time they'll make good public policy. Where we get in trouble is when the representatives begin to depart from that. They stop listening. They stop working hard. They lose their integrity. And then predictably, people become very cynical and jaded about the potential of government to be a good partner in helping improve and maintain the quality of life in our country. Before I open it up to questions, I did want to let you know that we've just printed up a new constituent services guide. This actually was a mailer, so some of you here may have received it in recent days, but we have additional copies in the back and can always provide more. This basically outlines where our offices are. We have one in Towson, Annapolis, and Burtonsville in Montgomery County, as well as our Washington office. Outreach hours that we do on a regular basis, monthly, so that people can come in and seek our assistance. And then the kinds of issues we can help with: Medicare questions, Social Security, veterans benefits, and so forth. That's, of the many things that I'm able to do as a member of Congress, and listening to testimony, voting on important issues in Washington are among them. Serving my constituents is the thing I put at the top of the list, because whatever frustrations I'm feeling about the progress of things in Washington, I can always help people if I'm paying attention and listening right here in my district. So please feel free to take advantage of those constituent services. I also produced, just for this tour I'm doing, a kind of overview of some of the issues relating to Medicare and Social Security, in particular some of the benefits of the health reform effort in terms of strengthening the Medicare program, and that's available to you in the back as well, and we can talk more about that with some of the questions. So I appreciate very much, this is a terrific turnout, and I appreciate the opportunity to come, in a sense, introduce myself, since for Oak Crest I am now newly representing this area, and I look forward to any questions or comments or thoughts that you have. Yes, sir. Well, I think we needed to do something in the wake of what happened in Newtown, and frankly in the wake of what happened in Tucson. Gabby Giffords was a classmate of mine. We were friends. She came in the same year as me. In fact, my first campaign manager became her chief of staff and now runs her nonprofit organization. And so I felt something needed to be done. There's a lot of different proposals out there. I'm pretty supportive of most of them, but certainly a measure that would put in place common sense background checks, I think, is relatively modest. And when you survey most Americans, they would agree. And interestingly, the experts say that the number one thing you can do to make sure that criminals don't get hold of guns and that people who don't have sort of the mental capacity to responsibly own a firearm will not get guns is to put background checks in place. Now, does that mean that we can stop every criminal from getting a gun? Absolutely not. Does it increase the likelihood that you'll be able to avoid some of these situations? I think so. And I don't think that the downside in terms of impact on responsible gun owners, again, many of whom, including many who are members of the NRA, are actually supportive of the basic background check measure. I don't think it would have any negative impact on those Second Amendment rights. Now, we weren't able to get that through on the Senate side, although there were 54 votes cast out of 100. I was trying to explain that to my son yesterday as part of his government class. And we have these strange filibuster rules in the U.S. Senate, which create another hurdle. But I think that, unlike in the past, where the sort of coalition of groups that feel strongly about implementing some gun safety measures would maybe have faded away again, I think that the Newtown tragedy, the faces of those families, the faces of people like Gabby Giffords, make it very hard to ignore that going forward. And I think hopefully what will result is just a more balanced discussion and debate about it. I was talking to a fellow yesterday, a classmate of mine. I reached him in Australia. Australia is very much like the United States in its relationship with firearms, in that it's a very cherished right there. But they had a real tragedy, much like what we experience in this country in Newtown. And a very conservative prime minister, John Howard, stepped forward and put in place some basic measures to create a little more accountability. And that's now been in place for a period of years, and most Australians are very comfortable that they have that. So I think the discussion will continue, and I'll generally be someone who's looking for ways to place reasonable, common sense measures in place on that issue. There are background check measures with respect to purchase, yeah, and they can do checks like that, but it's typically with respect to firearms that are sold in like gun establishments and so forth. It does not cover these gun shows, for example, which ends up being 40% potentially of the amount of firearms that change hands in this country. That happens at gun shows. So the measure that was being proposed would have included gun shows within the background check requirement. It would have exempted family transfer of firearms. I mean, if you wanted to sell a firearm to your brother or something like that, that doesn't get included. It also was very clear, I mean, this is ironic, because there are many gun owners, I think, across the country who worry about there being a national registry of gun ownership set up, right? And some of you may not be bothered by that, others may be, but it was enough of an issue in terms of getting the legislation through that there was actually an explicit provision in the bill that said this will not create a gun registry. Yet, notwithstanding that, the NRA was claiming that it would do so. This is interesting, in the House version of the bill, we've gone so far as to say that it will be a felony punishable to up to 15 years in prison to try to create a national registry. That's the lengths we're going to try to assure people that this is not going to happen. But the biggest loophole to your initial question was this kind of gun show loophole. And the other problem we have is what's called straw purchasing, which is where somebody who does have a record, criminal record for example, gets a person who doesn't have that record to go purchase the gun on their behalf. And a fair amount of that also goes on. If you could increase some of the penalties and liability on the person who goes and does that on behalf of someone else, like if they knew that that's what's going on, that might deter some of that behavior and limit the number of guns that fall into the wrong hands as a result. So the discussion will continue. We're having, I think, a relatively, and you have to say relatively these days when you're talking about Washington, but a relatively constructive discussion right now in Washington about comprehensive immigration reform. One of the reasons for that is that I think all the various players in this drama have a reason to try to achieve something this time. Most surveys show that Americans broadly support some form of immigration reform. You have immigrant communities that have some expectations that that will now happen. You have the two political parties, I think, both see the benefits of it. Some might say, you know, Democrats want it and Republicans need it, for example, coming off the election. But in any event, all those forces are coming together in a way that I think could produce a meaningful bill over the summer. And we need to get, if we're going to move on this, it's like anything these days, if you don't get it done the year before the election, the chances of getting it done begin to shrink rapidly. The bill that the Gang of Eight out of the Senate put forward attempts to address most of the major issues that people are concerned about. One is border security, and so there's pretty strict provisions in there about boosting up enforcement to protect the border. Two is what is the roadmap or pathway, however you want to term it, that you offer to those undocumented immigrants who came illegally to this country, but many of whom have now become embedded in the economy of the country in ways that we're fairly dependent upon. What is the pathway they can take? The current proposal establishes a relatively burdensome path to take for that. I mean, ultimately it can be a 13-year path. One has to travel, you have to pay back taxes, you have to pay penalties, there's other provisions that kick in. The trick there is you want it to be rigorous enough that it's fair, but not so rigorous that nobody has an incentive to actually get on that path, because then people continue to sort of hide in the shadows, which is the system that we've had now. The third piece that's important is giving employers a way of verifying whether somebody is here legally or not. And we have kind of a patchwork system now. There is this E-Verify system, which in some states has been adopted relatively successfully, but in others has not. The immigration proposal would basically establish that as a nationwide system. And then employers will have something that they can actually consult. It has to be reliable in making a judgment about whether to hire somebody or not hire somebody. The other thing that accomplishes is, and I'll get to your question in a minute, but the other thing that accomplishes is there have been some employers who've kind of winked and nodded at the problem. So on the one hand, they say, you can't work for me if you're undocumented. On the other hand, they're going like this because they can pay lower wages and otherwise take advantage of the situation. That's not most employers, obviously, but there are some unscrupulous employers that have taken advantage of the situation, and hopefully that can be remedied. It's fair for employers to expect a higher level of enforcement, particularly those employers who've tried their best, used all best efforts to comply with the system. And we have to have a way of collecting this information that also isn't so burdensome on the employers going forward. So it's a combination of enforcing the requirements we have, also updating kind of the practical element of how you can comply with that, using more electronic resources and so forth. And then where there are gaps in the system in terms of being able to verify somebody's status, their citizenship or work status here, be able to close those gaps. All of these things are in the discussion now. It's going to be debated, I think, very intensely, and the devil will be in the details. So we'll see how it proceeds. But I'm guardedly optimistic that we will see something meaningful occur on that front. Well, I share your frustration, and it borders on anger that we've not been able to process these claims in a more timely way for our veterans. I mean, it's sort of the least that we can do for people that step forward and put themselves in harm's way, particularly when they're returning. It was interesting, at that meeting with Secretary Shinseki, General Shinseki, who now heads up the VA, there was a woman who was describing why it's complicated in terms of reviewing these claims for benefits and making a decision about who should be awarded benefits and at what level. And I'll come back to that in a minute, but she mentioned something startling. She said, if you're talking about a World War II veteran, you're talking about maybe 2 or 3 conditions that are being claimed. If you're talking about a Vietnam War veteran, you're talking about maybe 6 or 7. She says the veterans that are coming back now from places like Iraq and Afghanistan have anywhere from 11 to 15 separate conditions that they can base their claims upon, which is just a reflection both about how we become more sensitive to these service-connected impacts, but also the kinds of things that they're experiencing. So our delegation was quite worked up, let's say, about the situation at the Baltimore regional office, which is one of the regional offices in the country that has the longest backlogs in terms of catching up with these applications that have occurred. We were assured by General Shinseki that there has been a team put in place there that's actually going to be training the Baltimore office staff over the next 3 to 6 weeks. That during that training, they're also going to make sure that the claims continue to get processed because they're sort of farming them out to some other VA offices around the country to make sure that that happens. But also importantly, that they've begun to make the move from what has been a completely paper-based system to one that's more electronic and more automated, which will help to process these claims much more quickly. Now, I've heard that song before, and the last question I asked the general, as he was describing this move towards automation, and it sounds pretty good as he's describing it, but I said, has there been another time recently where the VA was moving to automation? And he conceded, yes, a few years back, we launched an automation effort, and it basically got stuck at a certain point, and then they backed off of it. Because what happens is if you have an agency that's anticipating a new system, they don't invest as much in the old system, but if the new one doesn't come online, then you've only further complicated the lives of the people that you serve. He sounds pretty confident, and I came away, again, cautiously optimistic, that they are going to be able to turn this around. But my office handles numerous complaints and grievances from veterans about the claims process. So we've got a direct line in to see what progress is being made. And the other question I asked at the end was, what should we be looking for? What indicators should we be focused on in 6 months to judge whether you're actually making progress or not making progress? And so they laid out some of those for us. So you can rest assured that my office, and I think the entire Maryland delegation, and of course others across the country are pursuing this as well, are going to stay very focused on this, because it's an embarrassment not to be able to provide this very basic service to those that have sacrificed so much and to the families that have sacrificed so much. On that topic, by the way, when I was first elected in 2007, in January 2007, I led a group of my freshman class members, newly elected members of Congress, to Walter Reed Hospital. so that we could understand exactly the situation being faced with respect to kind of the healthcare services that are available to our returning veterans. Since then, I've been very focused on the mental health issues that confront our veterans. I'll never forget, we had testimony from 2 soldiers who had encountered a lot of difficulty in terms of their mental health status and so forth. And what they said was, when we first came back, there were surveys that were given to us, but we just wanted to get home, so we knew how to fill them out without triggering some follow-up consultation with a psychiatrist or other professional. But if the VA had continued to reach out to us on a regular basis, there would have come that point in time when we would have said, yes, I need some help. I need to talk to somebody. And it's incumbent on us as a society to make sure that we don't sort of look away from the challenges that these returning veterans have, but to keep reaching out to them. I'm the author of the Vet Corps, which is a program inside the AmeriCorps program that is dedicated in its focus on our veterans and military families, giving them an opportunity to serve as they try to transition back into the labor force, and give the opportunity to others to serve our veterans. So that will remain a very important focus of mine. Well, first of all, hats off to Erickson and all of you for the interest that you've taken in the environment in the Chesapeake Bay, the awards that have been given here. This is an area that I put a lot of time and energy in. I am author of something called the No Child Left Inside Act, which is a play on words, but it's designed to enhance environmental education opportunities for the next generation, really embed that in instructional programming. We have a coalition of over 2,000 organizations across the country that support my legislation, which is to provide more funding out of the U.S. Department of Education for environmental education. But for example, one of the things that could underwrite are field trips from a Fullerton Elementary School to come out here and see what you've been able to do and connect to the outdoors and inform the science lesson that they may be getting. Our middle school science class may be getting. So I really want to connect our young people to the environment, to nature, because they're going to be the stewards of our environment. Climate change is a really important issue, and Henry Waxman, who's the ranking member on Energy and Commerce Committee, which I serve on, has made that, in a sense, his number one priority. We've spent, I think, an inordinate amount of time arguing over whether climate change is a man-made phenomenon or otherwise. My view is all the things that we would want to do to address climate change if we thought it was man-made are things we'd want to do anyway, because, for example, they would clean the air, they would reduce pollution and so forth. So just from a public health standpoint, we have a stake in pursuing that kind of a program. But I think if you have any doubt these days, it's hard to ignore what's happening with weather patterns, the violence of the weather events that we experience these days. And that's important because it's not, some people refer to it as global warming, which has one connotation. And on a chilly day in the summertime, you can say, what's the problem? Although the average temperatures are clearly rising. But when you phrase it as climate change, I think you more accurately capture the impact that we're feeling from this. And you see areas now of drought that never experienced drought so seriously, others that are experiencing floods. They get a 100-year flood, but they get it, they get one and then they get another one 5 years later. So there is, I think, a perceptible change in what's happening with the weather, and I think it's fair to have a program, a policy response to that, and also to be part of kind of a partnership of nations around the world that are taking this seriously. So first of all, you got to understand that healthcare reform was a 3-act play. Act 1 was just passing the bill in the first place, and we had a lot of sturm and drum about that. Act 2 was the challenge in the Supreme Court to the bill, and that was settled. And Act 3 was last year's election, where in a sense it got put to referendum again. Well, the result of all those things is the Affordable Care Act is essentially intact and implementation is beginning. So we've moved from a point of sort of vigorous debate over, what should be in it and what shouldn't be in it to, okay, let's get these provisions put in place that were designed to kind of respond to people's concerns. Concerns like young people that couldn't afford health insurance and now have the opportunity to go on their parents' health insurance. Concerns like people with pre-existing conditions not being able to get access to health care coverage because they have some condition, and there's millions that fall into that category. How are we going to address that? Concerns about the 45 million people in the country who don't have any health insurance coverage at all, which is not just a problem for them, but it's a problem for all the people who do have insurance, because what happens is you get cost shifting. They go into an emergency room, they get treatment, there's nobody to pay for that because they don't have coverage, so that cost gets shifted onto all the people who do have insurance coverage. So that's not a system that works particularly well, and we were trying to address that. So we're really into the implementation phase of this thing. It's going to be uneven because you have some states, for example, around the country who don't want to set up these health insurance exchanges. They had the option to do that, but they've sort of said, we don't want to do that. We'll let the federal government do it. You have other states like Maryland, which have been pretty proactive on this issue for a long time, who are ready to establish a health insurance exchange where people can go who don't have coverage right now. One thing I do want to mention, because it's a very important point, and it was a real motivator for me on the health reform, is that we got a lot of testimony from small businesses who did not have coverage for either the owner of the small business or for their workers, or were paying premiums that in some cases were 20 to 25% higher than the same benefit package that a large company was paying for, because they couldn't benefit from the insurance pool. So one of the things in passing health reform was we wanted to address the situation of small businesses. 60% of the uninsured in our country either own a small business or are employed by a small business. So when you establish an exchange, a health insurance exchange, that's meant to address the uninsured, in large measure, you're establishing something to address the situation of small businesses that can't afford coverage. Now, it's not like I can snap my finger, or anybody can, and overnight this will all be implemented smoothly. There's structural changes that are happening here. And it's going to take a while for them to get in place. But I'm very confident that with these changes, the premiums that small businesses and individuals and others are paying now over time will begin to come down relative to where they would have gone if we'd stayed on the same path. I think that in terms of if you're covered by Medicare, as most people in this room are, we achieved some savings in the Medicare program going out 10 years. But most of the savings we achieved, we are taking and actually putting back into the Medicare program to make it stronger. So examples of that are closing this donut hole in the Part D prescription drug benefit program, making sure in the meantime that when seniors are in that donut hole, that coverage gap that some of you know about, there's a 50% discount on brand name prescription drugs and a 21% discount on generic drugs. So that's one example of where we're trying to strengthen the Medicare program. Better coverage now for certain kinds of preventive care services. Medicare realized, based on the research, that it makes sense to cover 100% things like annual wellness visits for Medicare beneficiaries, coverage of mammography screening and glaucoma screening and colonoscopies, because the money the program saves in the long run, if people are incentivized to get those screenings done, outweighs the extra costs of covering it on the front end. So that's another investment of those dollars that we made. Another example I'll give you that produces some real savings. There was research and testimony about how a lot of seniors will go into the hospital to get surgery or some other procedure. Next thing you know, you're getting pushed out of the door. But you're not fully recovered yet. You're not in a position where you should be going home yet. But the hospitals were really aggressive about that. Well, what happens? 4 or 5 days later, you've got an infection, there's some other complication, you end up back in the hospital. It's not good for the patient. It also costs the system a lot more. So we put in place a system of penalties and rewards for hospitals across the country to be more careful about that. And then fundamentally, the thing I'm most excited about with the health reform effort was we finally recognized that if we begin to turn the emphasis of our system more towards prevention and primary care, not only will that result in savings over time, but it will result in better care for patients out there. So models like a medical home that's properly reimbursed, a primary care physician who gets reimbursed for helping to manage the multiple chronic conditions that a patient may have, to make sure you're going to the right doctors and there's not sort of confusion, that the medications you're taking all work together, things of this nature, which can result in better health and can reduce costs over time. We're moving towards that model. We can't get there overnight. But if you look at other healthcare systems around the world that are providing by various indicators a higher level of care and doing it at less of a cost, what they're doing that we're not doing is focusing in on this primary care and prevention side of the equation. So these are some of the things that are underway right now. And I think the message that Baucus was sending to Secretary Sebelius, and that Harry Reid was in a sense echoing, is this has got to be all hands on deck in terms of the agencies that are involved. The implementation has to be sort of done at the highest level with the highest kind of energy and focus that it possibly can, because these are big structural changes. We have to make sure that every dimension of this implementation is getting the focus it deserves. Now that's hard to do because resources, particularly now, are getting affected by the sequestration, which is this whole budget clash that we're having in Washington. And as I said before, I think what's going to happen is you're going to see uneven implementation. I think that there will be states, and I believe Maryland will be one of those, that will actually shine in terms of standing up these exchanges and demonstrating many of the positive benefits and potentials of the reform. There will be other states who frankly drag their feet for almost 2 years in terms of getting started on the implementation, which will complicate it. And there may not be good stories coming out of that, and so we'll sort of have a competition of, well, here's how it's working and why it's working, and here's where there's problems. But as long as there are examples that it can work and can work well over time, that can serve as a model for others, and I think begin to build confidence in the public that this can actually provide a meaningful benefit to us going forward. I can't speak to the bill itself. I'll go check on the status of it. The issue is one that's going to keep getting attention because actually my mother-in-law experienced the same confusion. She was actually in Texas visiting a relative and had the need to go to the hospital and got placed into this sort of observation status. And then the kinds of notices and bills and other things that were coming at us were quite alarming until we got in there and understood the situation. better. So in terms of transparency for patients, there's a lot we can do to improve. That's an example of it. Another example is still we're at this stage with our healthcare system where it's very hard to know what the cost of a treatment is in a way that you can kind of compare it under different plans and compare it between different providers and so forth. We need to have more transparency. It's one of the only products and services in our economy that doesn't have some kind of basic transparency associated with it, and that's fundamental. Let me talk about sequestration for a minute because it's really a silly way of doing budgeting. Basically what it does is it puts in place an automatic across-the-board cut on all of these agencies. In this fiscal year, it's about $85 billion spread across the agencies, about half of it affecting defense spending and half of it affecting domestic spending. The idea behind putting this crazy thing in place was that it would be so hated by Democrats and Republicans that we would sort of jump together in trying to come up with an alternative to it. But that hasn't actually happened. So the sequestration went into effect on January 1st for the 7 months through the end of this fiscal year. And then if we don't do anything before October 1st, the sequestration will go into effect for next year, which is another $85 to $100 billion of cuts. The analogy I've been drawing for people today is if you had a household budget and you had part of that budget was for medicine, and part of it was for heat, and part of it was for going to the movies, and someone came along to you and said, you've got to tighten your belt, you've got to find some savings, you wouldn't go cut the heat and medicine budget. You'd say, well, I'll cut the movie budget out for a while. But under sequestration, you're not allowed that discretion. So in that case, the analogy would be you'd have to cut all of those things. The movie budget a little bit, but also the heat and the medicine. Well, that's no way to do budgeting. And that's why there's going to be some significant impacts on these agencies, both in terms of the investments that they need to make more broadly, but also on their own workforce. And, federal workers, by the way, have already contributed $114 billion to deficit reduction over the next 10 years by taking a pay freeze that's now up to 2.5 years worth of pay freeze, adjustments on their benefits and so forth. But yet there's some in Congress who want to keep coming back to them like they're a punching bag and get more and more. Well, the danger of that is that at a certain point it begins to impact the efficacy of the agency, the morale of the workforce. And these are the people that are serving us. I mean, you want people at the Social Security Administration to be able to do their job so they can get those checks out each month. You want people that are processing claims at Medicare and HHS to be able to do their job. If you keep cutting the capacity over time, you degrade the ability of government to provide quality services. Now, I will say this. I think, unfortunately, there are some in Congress, they're not a majority, but they're a large enough group that they're having a real impact on our ability to get things done, who really don't believe that government has any role to play, any constructive role to play. And their overall aim, I think, is to kind of shrink it down to a place where it's inoperable. And that's not going to be good for the country. I understand better than anybody, I understand as well as anybody that we can find savings and efficiencies in these agencies and bureaucracies and so forth. We can always do that, and we should. But you start cutting into the bone of some of these essential services, and it will begin to impact the quality of life for the country. And at a time when we need to maintain some very important investments, even as we are trying to address the deficit and the debt and so forth. So there are a lot of tough issues. I will keep doing my best to work those issues. I will thank my lucky stars that I can come home every night sometimes I joke to my wife that I feel like Clark Kent. I'm a lawmaker by day and I'm angry constituent by night, because by the time I get halfway up 95, I'm shaking my fist at what's going on in Washington. But it really benefits me to be able to stay in close contact with my constituents, people like yourselves, and I'm glad to be able to now represent Oak Crest, and I look forward to coming back the next chance I get. Thank you all very much.